Happy New Year. Today I will report on the continuing rise in COVID cases. I will outline our approach to managing this phase of the pandemic. Part of that, I'll set out immediate changes to the requirements for self-isolation and testing. And while we are not proposing any additional measures at this stage, I will confirm that existing protections and guidance will remain in place for the coming week, pending further review. And finally, given that Omicron may not be the last new COVID variant that we face, I will also signal some longer-term work to consider the adaptations necessary to enable us to deal more proportionately and sustainably with any future phases of the pandemic. First, though, today's statistics: 16,103 positive cases were reported yesterday, 26.9% of all tests carried out. 1,223 people are in hospital with COVID. That's 71 more than yesterday, but it is 544 more than at this time last week. 42 people are in intensive care, which is the same as yesterday, and sadly a further 5 deaths have been reported, taking the total number of deaths under the daily definition to 9,872. And once again, I send my condolences to everyone who is mourning a loved one. The surge of cases driven by the extremely infectious Omicron variant is continuing here in Scotland, across the UK and indeed in many other countries around the world. Here in Scotland over the past week, the total number of new reported cases has increased by 87%. Tomorrow's figures will almost certainly see us pass 1 million reported cases since the outset of the pandemic. However, the rapid and very widespread transmission of Omicron is such that the daily recorded tally of cases, which has always been an underestimate of the true level of infection, now gives us an even less comprehensive indicator of how prevalent the virus is. The weekly survey published by the Office of National Statistics gives a better indication. In the week to 23rd December, it suggested that 1 in 40 people in Scotland had COVID. The results of the most recent ONS survey, published just a few minutes ago, suggest that in the week to 31st December, that had risen to 1 in 20. The proportion of people with COVID is, though, likely to be even higher than that now, a few days later, and I would anticipate that we will see continued growth in the level of infection as work and school resume after the holiday period. In short, COVID is significantly more widespread now than at any stage in the pandemic so far, and will almost certainly become even more so in the days to come. This, of course, has extremely serious implications for the NHS and social care, but it also has a severe and increasing impact on the economy and other critical services. This is primarily due to very high numbers of people off work with COVID, but it is, of course, compounded by the wider requirements for self-isolation. As I said last week, we have been considering very carefully the risks and benefits of changes to self-isolation requirements, and I will update on that shortly. More generally, as I said a moment ago, we are not proposing any new protective measures today. However, with the virus so prevalent, we do consider it's important to continue to apply some brake on transmission, particularly in settings posing the highest risk. Accordingly, I can confirm that the restrictions on large gatherings, the requirement for distancing between groups of people in public indoor places, and for table service in hospitality venues serving alcohol on the premises will remain in force for now, and indeed I expect until the 17th of January. In addition, while this is not a legal requirement, we are continuing to strongly advise the general public to limit contact with people in other households as far as possible, and to limit the number of households in any indoor gathering that does take place to a maximum of 3. After 2 long years of this pandemic, I know that asking people to cut all social interaction is just not feasible, and it would be damaging, of course, to mental health and well-being. However, limiting contacts insofar as we can and thinking carefully about the interactions that matter most to us is important just now. It helps to stem, at least to some extent, increases in transmission, and so it has a collective benefit but it also helps protect us as individuals. When at least 1 in 20 of us have the virus, as is the case now, the risk of getting it when we mix with others is really significant. So if we limit the occasions on which we do mix, we also reduce our own risk of catching a virus that we know could have a nasty impact on our health. Trying to stem transmission, at least to some degree, is also important for the NHS, which is under increasing pressure. On the upside, the evidence that Omicron causes less severe illness than previous variants, at least amongst the under 60s, where the virus is most prevalent at the moment, does appear to be strengthening. Indeed, the fact that the numbers here in intensive care are so far remaining stable, while the numbers in hospital are rising quite sharply, may be indicative of this. We also know for certain that a booster jab provides strong protection against serious illness for people of all ages. However, notwithstanding the success of the booster programme and indeed the apparent lower rate of hospitalisation from Omicron, the sheer volume of people becoming infected means more people with COVID are being admitted to hospital. There is also remaining uncertainty about the impact on hospital admissions if Omicron continues to spread from younger age groups, where the risk of falling seriously ill from COVID has always been lower, to those in older age groups. As I reported last week, work is also underway to better understand the detail behind the headline hospital numbers. I can advise Parliament that the first results from analysis to differentiate those who are in hospital because of COVID from those in hospital with COVID but who were admitted for different reasons will be published on Friday. Work is also being done to assess whether the average length of hospital stay resulting from Omicron is any different to that associated with other variants. So in short, our understanding of the precise nature and extent of Omicron's impact on hospitals and the wider health and social care system is still developing. However, what is beyond doubt is that it is already having a considerable impact. The number of people in hospital with COVID has increased from 679 to 1,223 in the past week. That's a rise of 80%, and that is putting significant additional pressure on the NHS. Indeed, the NHS is now facing increased pressure on 3 related fronts. First, from dealing with non-COVID backlogs built up over the course of the pandemic. Second, many NHS staff are absent and self-isolating, either because they have COVID or are close contacts of people with it. This means the increasing pressure on the NHS is being managed by a depleted and ever more exhausted workforce. And let me say, at this stage, we owe each and every one of them an enormous debt of gratitude. And third, as we keep saying, even with a lower rate of hospitalisation, the sheer volume of cases caused by the much greater transmissibility of Omicron is leading to more patients with COVID ending up in hospital. And with reference to the analysis to be published on Friday that I spoke about a moment ago, it's important to remember this. Even if COVID is not the primary reason for someone's admission to hospital, the fact they have COVID means enhanced infection control measures are necessary, and that further constrains the capacity of the NHS, so exacerbates that pressure. We continue to support health boards and staff to manage this pressure. This includes working with councils to reduce delayed discharge and targeting additional capacity where possible. Work is also underway, importantly, to develop alternative patient pathways for people with COVID, enabling them, where possible and appropriate, to remain at home with appropriate monitoring and advice rather than be admitted to hospital. And this work will also help identify at an earlier stage patients likely to benefit from new antiviral treatments. Of course, we can all help the NHS by taking steps to reduce transmission of the virus as much as possible. Presiding Officer, while abiding by current guidance and protections is at this stage vitally important, we do know that measures which restrict our lives are not sustainable indefinitely. And with a variant as infectious as Omicron, the kind of protections that are still possible within our financial resources and without causing greater harm in other ways, while still very important at this stage, won't control transmission to the same extent as these measures would have done with other less transmissible variants. So in light of this, coupled with the fact that unfortunately COVID won't suddenly disappear and that Omicron is unlikely to be the last new variant we encounter, we need to continue to adapt our thinking about how to manage the virus and become more resilient to it in future. Now, let me be clear at this stage, this does not, in my view, mean giving up on trying to control COVID completely. The impact of it on individual health and on our collective well-being is too significant for that. But it does mean seeking ways of doing so that are more proportionate, more sustainable and less restrictive. There are no easy answers here, but adapting to the ongoing challenge of COVID is inescapable. The Scottish Government is therefore currently working on and will publish over the next few weeks a revised strategic framework which will set out more fully how that process of adaptation can be managed with a view to building that greater resilience. We will seek views from across Parliament as we develop this new framework in more detail. However, the changes I am about to confirm to the requirements on self-isolation and testing are an early indication of an already adapting response. I said last week that it was important to consider carefully changes to self-isolation rules. We wanted to ensure that such changes are made only when, in the view of clinical advisors, the benefits of them outweigh the risks of them. I also want to make changes as far as possible in a coherent, not a piecemeal manner, given the importance of clear public understanding of what is required. As a result of this consideration, we are now proposing 2 changes to the self-isolation rules and 1 change to the requirement for PCR testing, and all of these changes will take effect from midnight tonight. The first change to self-isolation applies to those who test positive for COVID. While the initial advice when someone tests positive will still be to self-isolate for 10 days, there will now be an option to end isolation after 7 days, as long as you, firstly, have no fever, and secondly, you record 2 negative lateral flow tests, one no earlier than day 6 after testing positive, and another at least 24 hours after that. The second change applies to close contacts of positive cases, and this includes household contacts who are either under the age of 18 years 4 months or who are older than that and fully vaccinated. And let me be clear, by fully vaccinated, we mean first, second and booster or third doses. For close contacts in these categories, the requirement to self-isolate will end and be replaced by a requirement to take a lateral flow test every day for 7 days. Obviously, if one of these tests is positive, self-isolation will then be required. Anyone identified as a close contact who is over 18 years and 4 months and not fully vaccinated will still be asked to self-isolate for 10 days and to take a PCR test. These changes are significant and they are not completely without risk. However, at this stage of the pandemic, they do strike an appropriate balance between the continued importance of self-isolation in breaking chains of transmission and reducing the disruption self-isolation causes in the economy and other critical services. We're also proposing an important change to the advice on testing, and let me be clear again, this has been very carefully considered. Scotland, indeed the UK as a whole, has one of the most extensive PCR testing systems anywhere in the world. However, with infection levels as high as they are, we must fully utilise all available testing capacity, PCR and lateral flow, and make sure isolation and advice happens as quickly as possible. For those who have symptoms of COVID, the advice remains to book a PCR test, even if you have a positive lateral flow test. And of course, the advice to everyone is to test regularly with lateral flow devices, especially before meeting up with others. However, from tomorrow, if your lateral flow test is positive and you do not have symptoms, you will no longer be required to take a PCR test to confirm the result. Instead, you must immediately isolate and also report your result online so that Test and Protect can commence the contact tracing process and give you advice as quickly as possible. You'll also receive an online form that you must fill in, as would happen with a PCR positive, to ensure your contacts are notified. Other countries, Canada for example, have already made this change. It has been made possible because lateral flow tests are now widely available and work well. Also, and really importantly, the Test and Protect system in Scotland can start contact tracing on the strength of a reported positive lateral flow result as well as a PCR. And crucially, at times of very high levels of infection, the risk of a false positive lateral flow result is very low indeed, around just 3 in 10,000. So the safest thing to do at this stage is to treat a positive lateral flow test as confirmation of COVID, even if you have no symptoms. This allows us to maximise testing capacity and ensure a speedier start to the process of contact tracing and advice. Presiding Officer, there are a few further points I want to briefly touch on today. Firstly, the current situation continues to take its toll on everyone, of course, but it continues to take a toll on businesses. Last week I confirmed the allocation of more than 200 million of the £375 million in business support we are making available. Today I can confirm the allocation of a further £55 million. Up to 28 million will be allocated to taxi and private hire drivers and operators. £19 million will support services such as beauticians and hairdressers. £5 million will be provided for sport, and an additional £3 million for tourism. Local authorities are, as we speak, working to get money to bank accounts as quickly as possible. Secondly, in light of the widespread community transmission of Omicron in the UK just now, discussions are taking place today between the 4 UK governments about possible changes to travel rules, including the requirement for pre-departure testing. If these discussions result in proposed changes, we will inform Parliament as quickly as possible. My third point relates to education and the start of the new term. All secondary school children are being asked to take a lateral flow test on the night before or morning of the first day back, and thereafter to test twice a week, and also in advance of mixing socially with people from other households. Likewise, university and college students should take a test immediately before travelling from home to term accommodation, and thereafter twice a week and before socialising with people from other households. And staff in all educational and early year settings should take a lateral flow test just before starting back to work, and in line with broader advice after that. Our priority is to keep schools open and to minimise further disruption to education, but with community transmission high, I know the next few weeks will be challenging for pupils, staff and parents. Using lateral flow tests will help, so too will the changes to isolation rules, and updated education guidance reflecting these changes will issue shortly. We will also work with councils to ensure the guidance issued before Christmas is followed to keep schools not just open but as safe as possible. Presiding Officer, my final brief update today is on vaccination. I am immensely grateful to everyone involved in delivering vaccines and to everyone who has been vaccinated. By the bells in Hogmanay, around 3 million people, 77% of those eligible, had received their booster or third dose. If you weren't one of these people and you are eligible, please come forward now. You can arrange an appointment online or go to a drop-in clinic. There's plenty of capacity. You can get details at NHS Inform or your local health board's website. Getting a booster doesn't mean we won't get COVID, although it does reduce the chances of that, but it significantly enhances our protection against serious illness. It could quite literally save your life. 12 to 15-year-olds can also now go to drop-in centres to get the second dose. I encourage everyone in that age group to do so. If you're the parent or carer of someone in that age group, you can go with them to the vaccination centre. The vaccine programme has been an outstanding success, but there are still many people eligible but not yet vaccinated. If you are one of them, then for your own sake, and indeed for the sake of all of us, please rectify that. It is not too late, and no one will judge you for not having done it before now. On the contrary, you will be welcomed with open arms. Presiding Officer, this phase of the pandemic is possibly the most challenging we've faced so far. The most infectious variant so far is creating a volume of cases that, notwithstanding its possibly reduced severity, still has the potential to overwhelm us. And of course, 2 years in, the kind of measures that have helped us control transmission in past phases are becoming less tolerable and causing more harm. So while not easy, we do need to continually adapt our ways of managing this virus, and we will do so. But in the meantime, we must continue to do what we know makes a difference now. So get fully vaccinated as soon as you can. Please do it this week. The more of us who are boosted, the less severe the impact of Omicron will be for each of us as individuals if we get the virus, and for society as a whole. Second, limit your contacts. Right now, with infection levels at 1 in 20 at least, every interaction we have comes with a significant risk of catching the virus. So we should prioritise the contacts that matter most to us. Third, if you're meeting other people, test before you go every time. And finally, take all the other precautions which make a difference. Work from home whenever possible. As the new working year gets underway, I'm appealing again to employers to enable this. Wear a face covering on public transport, in shops, and when moving about in hospitality, make sure it fully covers your mouth and nose. If you're meeting indoors, limit the number of households in your group to 3 at most, and keep windows open, and follow all advice on hygiene. I want again today, Presiding Officer, to record my thanks to everyone across the country who continues to do all of this and play their part in helping us through this latest very challenging phase of the pandemic. Thank you very much indeed, and I, of course, am happy now to take questions.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 55 minutes for questions, and I'd be grateful if members who wish to ask a question could please put an R in the chat function. And I call Douglas Ross.
Thank you, Presiding Officer. I welcome the changes to testing rules. These are sensible and proportionate changes that are similar to what we're seeing in other parts of the United Kingdom. I also welcome the changes to self-isolation, which the Scottish Conservatives have been calling for since day one. When they were introduced, we said this policy was not sustainable. Every other part of the United Kingdom made the change, but Scotland was left as an outlier. So, First Minister, why did it take so long to make this change here in Scotland?
First Minister.
I make no apology for considering these things very carefully. My clinical advice until now has been that it was possible that the risks of this in releasing people from self-isolation too early and therefore contributing to a greater increase in transmission outweighed the benefits. That balance of judgment has now changed, and after careful consideration, we are making this judgment today. None of these things are straightforward. I would doubt that there is any government anywhere that is making these decisions lightly. They certainly shouldn't be. And sometimes we will arrive at different judgments for good reason. I will always be accountable for and open to scrutiny on the judgments I make, but I will continue to take these judgments really carefully and with the best possible clinical advice. Even today, the changes we are announcing, although I think they are proportionate at this stage in the pandemic because they balance the benefits of isolation with the disruption that isolation caused, they are not without risk. And that is why it's really important that we communicate them properly and that people understand not just what the easing of some of these rules are, but what we are asking people to do in place of these. And that applies to the changes on self-isolation, but it also applies to the changes around confirmatory PCR testing after an asymptomatic LFD positive result. Look, Douglas Ross and I have had exchanges in the past, and I say this non-pejoratively. This is the stuff of scrutiny and democracy, but at times in the past, if I had followed Douglas Ross, we would have removed the requirement for face coverings, I think prematurely. We would not have some of the mitigations that we now have in schools that I think are seen to be really important. There have been differences, there will no doubt always be differences, but the trust placed in me, the responsibility placed in me by the Scottish people means that I have, with my ministers, the duty to weigh these things up carefully and, of course, be accountable for the judgments we arrive at.
Douglas Ross.
The First Minister mentioned there that the reason that Scotland remained an outlier was because of the clinical advice she received. So will she publish the clinical advice from last week, which meant this crucial change wasn't made, the clinical advice she has received this week, now the change has come into force? And she also mentioned about communicating properly. Yesterday, the Deputy First Minister the man who sits in her cabinet in charge of COVID recovery, claimed that virus rates were lower in Scotland compared to England because of the actions taken by the SNP. But John Swinney was using data from before the SNP's restrictions were introduced, and the most recent data shows in fact the opposite of what he claimed. Tackling this virus is not a competition, but John Swinney tried to make it one. So why is the Minister for COVID Recovery using misleading data to make petty political points instead of giving people the accurate information they need?
First Minister.
I don't think that's the case at all, and I'll come on to most recent data in a second. Firstly, though, let me deal with this issue of outlier. When the changes to self-isolation for index cases was first announced, it was only England that it applied to. So for a period, England was an outlier. Last week, I think Wales and Northern Ireland decided to introduce similar changes, and today we are doing likewise. At different times in this pandemic, we've come to different views substantively. Sometimes we've come to different views, or the same views, on different timescales. Right now, on protections, for example, Wales, Scotland and Northern Ireland are in very, very similar positions in terms of restrictions on gatherings and some restrictions and protective measures in hospitality. England is an outlier on that, not just an outlier in a UK sense, but arguably an outlier in a European and more broadly a global sense. We all have a responsibility to reach judgments based on our clinical advice, and the responsibility we have to keep the public in this most challenging of situations as safe as possible, and that's what I will always do to the best of my ability. In terms of the impact of the protective measures we have in place, it always has been and always will be very, very difficult, sometimes impossible, to prove causation between one measure and the outcomes in terms of virus rates. But I think common sense tells you that if we didn't have some restriction on large, potentially super spreader events right now, if we didn't have measures in place to try to stem, at least to some extent, the transmission in higher risk settings like hospitality, and if we weren't advising the public and the public weren't responding so magnificently well to advice to cut contacts, then high rates that we're seeing right now are likely to be even higher, and the pressure on the NHS significant. So we, I think, are right to be trying to apply some brake, notwithstanding the high levels of infection we face. I agree these things are not a competition. At times Scotland's had lower levels of infection, at other times we've had higher levels of infection. Right now, I think the levels of infection are lower. Whether they will remain, that's certainly than England, perhaps slightly than Wales, not so much Northern Ireland, but that is likely to change. My final point would be in relation to the Deputy First Minister's use of the ONS data yesterday. He used the most up-to-date ONS data yesterday. I've cited in my statement today data that, as I understand it, has been published while I've been speaking, that is a week more up-to-date. There'll always be a lag in it, that I think will still show that our 1 in 20, very, very high, is still lower, certainly than England. But these things are not a competition. We just all have to take the decisions and make the judgments that we think are best to try to navigate the safest possible course through that. And I will always seek to do that. I'll be held accountable and subject to scrutiny, and that's the nature of the job that I'm privileged to do.
Douglas Ross.
Well, I'm glad that's the nature of the job that the First Minister is privileged to do, and therefore, hopefully, on this occasion, she will answer my question on clinical advice. It has obviously changed, according to her answer, from last week, when self-isolation rules remained the same, this week when they've changed. So will she agree to publish that? Because data is crucially important. John Swinney said that data from Public Health Scotland would be published today, that the First Minister in her statement has now said that will be Friday. This is vital information on hospitalisations because of COVID and hospitalisations because people are unvaccinated. It's information that's essential for the public to know why they're being asked to put up with restrictions on their lives. It makes it difficult for anyone to judge the COVID situation properly when the First Minister has information, but the public does not. So can she confirm that Friday's update with this information will include all the facts and figures that we've been calling for and that the public need?
First Minister.
I'm not sure it'll contain everything the Scottish Conservatives have been calling for, because I think if we'd done everything the Scottish Conservatives have been calling for over the past few months, we would be in probably more of a difficult position than we are now. I've referenced some of the policy issues. We'll continue to take the best judgments we can, and we will continue to publish as much data and evidence as possible on the proviso that there is a confidence in the robustness of that data. We do publish evidence papers. We will continue to publish as far as reasonable and appropriate, the evidence and the advice underpinning the decisions we take. Ultimately, though, these decisions do involve the application of judgment. That's what people elect me and my government to do, to take the responsibility, to weigh up all of the factors and take the judgments and be held accountable for them. So last week, I did not think it was the case that the benefits of changing self-isolation would outweigh the risks. The higher transmission now, the bigger the burden of self-isolation on the economy has changed that judgment. And these are judgments that we will continue to have to make on a whole range of issues in the weeks to come. On the issue about the data that will be published on Friday, Public Health Scotland has been doing that work. It's important that that data is robust. So that data, and that will be the first results of the analysis, that will show the differentiation between those who are in hospital because of COVID, in other words, it's the reason for their admission, and those who are in hospital for another reason, but who have COVID, either they came in with it or perhaps contract it in hospital. That's important information to know. That's why we're doing that work carefully. But it's also important not to put too much store on that. And again, I refer to this in my statement. Just because somebody with COVID is in hospital for another reason doesn't take away the impact of COVID, because the fact they have COVID means that there has to be special infection control measures around that patient in terms of distancing and other things that apply. So that reduces further the capacity of the health service and increases the pressure. So it's important that we understand all these things as our knowledge about Omicron develops, but we shouldn't kid ourselves on that because somebody with COVID is in hospital for another reason, that somehow takes away all of the difficult impact of them having COVID has. So we'll continue to publish evidence, we'll continue to publish data, but I will also continue to do the job I'm elected to do, which is apply the judgment to all of that and reach decisions motivated by my desire, my responsibility to navigate the safest possible path through this pandemic.
Call Anna Sarwar.
Thank you, Presiding Officer. Can I start by passing my condolences to all those that have lost a loved one, and I would like to also put on record my gratitude to our vaccinators, NHS and social care staff, and all frontline workers who have continued to work and keep us safe over the Christmas and New Year period. I welcome the changes being made to the self-isolation period. There will be a relief for public services and businesses who are feeling the impact. I also welcome the broadening of financial support to businesses associated with hospitality, in particular the events, taxi and beauty industry. Issues have been raised about the speed of distribution and the impact that has on risking businesses going bust and people losing jobs. So can the First Minister commit to speedier distribution of these funds? We all agree that we must confront and challenge disinformation online. It undermines public health, but that isn't helped by the government providing unclear or partial information. There is clearly a difference between being in hospital or intensive care with COVID and being in hospital or intensive care because of COVID, especially if there is an outbreak in a hospital. So surely the First Minister is basing her decisions partly on this information. If she isn't, then why not? And if she is, then she must have seen that data and she should share it now. So can the First Minister commit to this data being made available as a matter of urgency so we can maintain public confidence in the decisions being taken and why?
First Minister.
On the first point, councils are responsible for distributing the money we've made available. I know how hard they are working to get that out the door and into the bank accounts of businesses as quickly as possible, and businesses, particularly in the hospitality trade, will be being contacted over the course of this week. So I know councils are doing that at speed, and that process will continue. In relation to the second part of Anna Sarwar's question there, I haven't seen the data around Omicron. Previously, data on this question was published by Public Health Scotland in relation to previous variants. I've not seen that data yet on Omicron. I've said in my initial statement the first results of that analysis will be published on Friday, which is as soon as Public Health Scotland consider it will be in a robust state to publish. But lastly, this point, which I covered in my answer, well, in my statement and also in my answer to Douglas Ross, yes, there is a difference between somebody being in hospital because of COVID and in hospital for another reason but having COVID. But we shouldn't overstate that difference, because if they are in hospital with COVID, even if the reason for their admission is something other than COVID, the fact they have COVID means that they have to have the same protective infection control measures applied as somebody in hospital for COVID. So the impact on the individual may or may not be different. If you have another condition, having COVID potentially will exacerbate and complicate that other condition, but the impact on the hospital, on the National Health Service, is not as different as people try to suggest. The bed that is occupied by somebody with COVID is occupied with infection control measures around it, whether they're in because of COVID or in with COVID. So yes, let's understand this, but for goodness sake, let's not overstate the importance of that differentiation in terms of the impact of these admissions on the National Health Service.
Anna Sarwar.
I'm not sure the First Minister deliberately confuses the issue. No one is questioning whether having a patient with COVID impacts on hospital capacity. But what it does impact is on people thinking about how dangerous this variant is to them, their life and to their loved ones. So level of hospitalisations and levels of infection of those in intensive care due to the COVID outbreak is really, really significant and really important, and why people are measuring how they need to restrict their lives and how they live it and the impact it then has on businesses. So that data is really, really important, and people have been asking for it for weeks since Omicron broke out. So I think the urgency of it is really important so we can maintain public confidence in the restrictions being taken. So I would repeat the public health advice. The vaccine works. Please do go and get your vaccination if you haven't had your first, second or booster dose. If there isn't too late, there isn't any embarrassment, please book an appointment and visit a drop-in clinic. Please also follow the restrictions. Please do take lateral flow tests. Please do go for PCR tests if you are eligible for doing so. Another issue I raised last week was testing capacity, and I note the new arrangements on testing. But issues still remain for the wider population and key workers, issues around PCR capacity, but also supply of LFD tests. And across Scotland, key workers in NHS and beyond are reporting waiting days for PCR test results, despite promises of a fast-track service for frontline workers. A number of staff are having been in touch, saying they're delayed from going back to work for days as a result of that capacity. So given the new protocols on testing, can the First Minister confirm that LFD supply and distribution issues have been resolved? And can she clarify who is now eligible for a PCR test? If you are symptomatic after an LFT, for example, should you go for a PCR test? Will there be new guidance published around PCR test eligibility? And will the new freed up capacity be prioritised for frontline NHS and social care workers?
First Minister.
Let me take these issues in turn, and they're all important issues, so forgive me, Presiding Officer, I'll try to do it as briefly as possible. I want to give substantive answers. Firstly, to return to this issue of the distinction between people in hospital with COVID and in hospital because of COVID. Anna Sarwar's points are not unimportant, and I'm not suggesting they are, but I would also ask him on the point he's making about severity, equally not to oversimplify things. As I said in my statement, all of the evidence we have so far, including the evidence from admissions to ICU in Scotland, which are not rising at the rate that hospital admissions are rising, suggests that the impact on individuals of Omicron is less severe than previous variants. Now, whether that's an inherent milder version of the virus or whether it's the effects of vaccination, we don't know for sure, but all of the evidence points to that. But there's two caveats we need to make there. One is that is evidence that is based so far on the circulation of Omicron largely within younger populations, which throughout this pandemic have been less likely, not completely unlikely, but less likely to fall seriously ill. We need to continue to monitor that if the spread, as is happening now, moves from younger populations into older age groups. That's the first caveat. The second caveat is about volume. That even if the rate of hospitalisation, therefore the severity, is much less, the sheer volume of cases will add up to significant pressure, is already adding up to significant pressure on the National Health Service. And that is not abstract or academic for people's health, because if the hospitals are so full of COVID cases that they can't treat in the way they want to other conditions, heart disease or whatever other conditions, that has an impact on people's health. So even if not all of the people in hospital are in because of COVID, that does not mean that we should be complacent in any way for any reason about the mounting pressure on our hospitals. And I hope that is clear. I recognise the points that are being made, but I appeal to opposition leaders not to oversimplify these issues, because I don't think that helps anyone. On the issue of testing, we will, with community transmission as high as it is just now, we will periodically have pressure on the testing system, and we are working on a Four Nations basis because most of our testing capacity is through the Four Nations system, although we also have quite considerable NHS Scotland testing capacity. We work on a daily basis to resolve and to flex the capacity as far as possible. Right now, there's no shortage in Scotland of LFD tests. We monitor the supply of those very carefully, and issues that we were seeing with turnaround times have improved again, and turnaround times have become much shorter again. The essential workers route to prioritise PCR testing is there. There's also the sectoral exemption process that is available to NHS workers and key workers in other sectors. And lastly, we will ensure that there is guidance on the latest testing advice, but I think I did make this point clear in my statement, but if I didn't, let me repeat it. If you have symptoms of COVID, then even if you've taken an LFD test that is positive, the advice is to still book a PCR test. It is only if you have no symptoms and your LFD test is positive that we're then saying there's no need to take a PCR test, not just because we're trying to maximise testing capacity, but because it is a pretty safe assumption, given levels of transmission right now, that you are positive, because the false positive rate is so low, and working on the basis of that positive LFD test allows the contact tracing process to kick in as quickly as possible. Obviously, if you have symptoms, there's a variety of reasons that we would still want PCR testing to happen, not least as we get more antiviral treatment to allow us to assess patients who are most likely to benefit from that.
I call Alex Cole-Hamilton.
Thank you very much, Presiding Officer. At the start of this pandemic, the government carried opposition party support for public health measures by providing us with almost real-time information about the advance of the virus. It meant that we were all signed up to the precautionary principle of hinging decisions around data rather than dates. But that transparency has ebbed away. 6 weeks of Omicron in Scotland, and we will only learn on Friday who is in hospital specifically because of Omicron severity, despite some of those details already making their way into the national press. If the First Minister is still leading the public health response to COVID on the basis of data and not dates, does she recognise the importance of being more transparent with the information she has if she's to bring us with her? And secondly, can I ask specifically about PCR testing? Vice information published by the government at lunchtime, in answer to my request last week, has revealed that PCR testing capacity is actually quite significantly down on what it was last year, to a little over 50,000 tests a day. Does she recognise that this will have resulted in health workers waiting, in some cases, days for a negative result?
First Minister.
Let me take both of those questions. Firstly, the reason that I'm not sharing the data on people in hospital because of COVID versus people in hospital with COVID is not because I'm not being transparent, because I don't have that data yet, because Public Health Scotland are doing careful work to make sure that that data, when it is published, is robust and reliable. They published data on that question previously with the past variants of the virus, and they're doing that work again. So it's not trying to hide that data. We want to make sure it is reliable and that what is published is data that people can have confidence in, and it will be published on Friday because that's when Public Health Scotland consider they will reach that state. There's no point in publishing data that is not reliable because it doesn't help anybody. Beyond that, I'll continue to be as open and transparent as possible about data, about evidence, but ultimately, as I've said before, the data and the evidence doesn't make the decisions, it informs the decisions. The decisions have to be taken by those of us who are elected to carry that responsibility, and that does involve the application of judgment. And that is what I'm elected to do, and it's what I am held accountable for. But we'll be as open and transparent as we have been all along about the data and the evidence underpinning that, but I make no apology for wanting that data to be as robust as it can possibly be. On the issue of testing capacity, I don't accept that categorisation. As of today, in terms of the UK testing network, Scotland's allocation share of that is about 50,000 a day. Over and above that, we have NHS Scotland capacity of around 32,000 per day. That testing is fluctuating at the moment. It always fluctuates for a variety of reasons. If there's equipment failure in one of the labs, for example, then it will be down a bit while that is repaired. But right now, as with so many other parts of society, one of the reasons for fluctuation is staff absences because of COVID and self-isolation in our laboratory network, which is another reason the changes I'm announcing today are at the moment, I think, appropriate. But we continue to work with UK government colleagues to maximise testing capacity on a daily basis. But we need to see testing capacity not just as PCR, important though that is, but to utilise fully the LFD capacity as well, which is what lies behind the testing change that I've announced today.
Thank you. Understandably, there's a great deal of interest from members to put questions to the First Minister, and I would be grateful for more succinct questions and responses, and it is my intention to allow this session to continue beyond the scheduled time in order to take as many questions as possible. I call Gillian Martin to be followed by Sandesh Gulhani.
Thank you, Presiding Officer. I note in the First Minister's statement that adjustments to the isolation advice have been made, and I'm certain that people are respectful of advice given based on the science, and I trust it's the science behind the government's decision. So I won't ask the First Minister to go over again the clinical basis that there is for these adjustments, because she's been more than comprehensive today. The First Minister has said that fully vaccinated close contacts of those who have tested positive but who themselves have a full week's worth of negative lateral flow results will not have to isolate beyond 7 days. Now, in my area, people have told me that they are sometimes finding it challenging to get hold of enough lateral flow tests, particularly when they've got large families. Can the First Minister say what's been done to ensure that a supply in every area is available to make sure everyone can play their part in protecting others and to test at home?
First Minister.
Thank you. Can I just be clear that the change for fully vaccinated close contacts, including household contacts, is that the requirement to self-isolate at all will be replaced by daily lateral flow tests for 7 days. So as long as on each day your lateral flow is negative, you don't have to isolate, but on any day, of course, that your lateral flow test is positive, you do then have to start isolation. Again, that's something we've considered carefully. We think the benefits outweigh the risks, but none of this, of course, is risk-free, but we think this is a proportionate change overall at this stage. It does mean, of course, that the supply of lateral flow devices, always important, is even more important. So through all of the various routes, we're working with UK colleagues, with colleagues in the community pharmacy network, in the local testing centres, to make sure that there is a good supply of LFDs. There's no shortage at the moment. Procurement is ongoing to make sure supplies continue to be topped up. So right now you can mail order LFDs, you can get them from local pharmacy places or local testing centres, and a number of councils are making lateral flow devices available in other places as well. There's also the key worker workplace testing, which businesses that are part of that know how to access.
Sandesh Gulhani to be followed by Jackie Bailey.
Thank you. First Minister, the Scottish people are struggling under the restrictions that are in place, some of which have been in place for a long time. Look, we all appreciate that COVID necessitates some restrictions, but what information does the Scottish Government base its decisions upon? We simply don't know. And so to help the people better understand, and in terms of transparency, will you commit to publish weekly, ahead of the announcement, all the data the Cabinet bases its decisions upon?
First Minister.
We've published acres of data and evidence. We will continue to do that. But I come back to the point, the data and the evidence doesn't make the decisions, they inform the decisions. Look, I would hazard a guess that the member, who I know is a clinician himself, is in a minority of clinicians right now who don't think, or who think that no protective measures are required. Indeed, Scotland, Wales, Northern Ireland, many countries across Europe and the world are all in a similar place in some proportionate but necessary protections to try to stem, even to some extent, the rise in cases. And what is the rationale behind that? We know, particularly with Omicron, given its greater transmissibility and infectiousness, that large-scale events have the potential to quickly become super-spreading events, which is why we have, regrettably, put a temporary restriction on large events. We know that the kind of environments in hospitality where people come together, often poorly ventilated, with alcohol, lowering inhibitions, also raises risk of transmission, particularly with a greater transmissible variant. So that's the rationale for the particular targeted measures we have in place. We know from evidence that face coverings help, perhaps more than many other measures, reduce transmission. So actually, and I would expect somebody clinically qualified probably to understand this better than most, that all of these targeted measures that are in place right now are in place in many, many other countries, and all of them flow from our understanding of how a virus spreads, and in particular, given its greater transmissibility, the risks that the spread of Omicron presents.
Jackie Baillie, to be followed by Jim Fairley.
Contrary to what the First Minister said earlier, the Deputy First Minister did cite ONS data to justify his argument about how much better we're doing in Scotland because of restrictions here. The data he used covered the period up to the 23rd of December. That, of course, was before restrictions were introduced, when the rules were largely the same in Scotland and in England. Analysis by the Financial Times showed that the 7-day rolling average of cases up to the 3rd of January has Scotland with a higher percentage case numbers than England. ONS figures published today show largely the same level of infections in Scotland and England, other than in London. So I absolutely agree with the First Minister that this is not a competition, but would she agree with me that it is essential that ministers do not spin statistics and create misinformation which would weaken public confidence?
First Minister.
I don't think anybody's seeking to do that. It's not a competition, but since I've been asked these things, let me again. The Deputy First Minister cited ONS statistics yesterday. I didn't say he didn't. What I said was that he cited the most up-to-date ONS statistics, which until 2 o'clock today were the ones he cited yesterday. We have further data today that I've already cited, so I won't go into detail again. I would urge significant caution about the rolling average, 7-day rolling average of cases up to the 3rd of January in any part of the UK, because of the disruption to reporting over the Christmas and then the New Year holiday period, and the different pattern of testing we know is there when there is a holiday period. So I think I would treat those figures with significant caution. And also, as I've said, we know that the daily reported cases are a significant underestimate in all countries of the true prevalence of the virus. But if Jackie Baillie wants to make this point and get an assessment of the overall performance of Scotland to date, because it may change next week or next month, then overall, in terms of the pandemic to date, levels of infection in Scotland, and you can go into the UK government COVID dashboards and see this for yourself, overall levels of infection in Scotland are lower than, I think, in all other parts of the UK, certainly England and Wales. I can't recall exactly if that's the case for Northern Ireland. So does that say we've managed our way through this pandemic perfectly? Absolutely not. But it does suggest that the balance of judgments that we're taking, sometimes we'll get them more right than on other occasions. The balance of judgment have led us to that position. But I'm not complacent about this. We face ahead of us a really difficult period, and that's why my responsibility is just to take the decisions based on data and evidence, but applying my judgment, which is my job, the decisions that I think are likely to get us through this as safely as possible. And if they accord with decisions elsewhere in the UK, all good and well. But if they don't, then that will be for good reason that it is then my responsibility to set out for people and to allow people to decide.
Before I move on to take